Hi, it's Dr. Justin Marchegiani here, and today's talk's going to be on functional medicine lab tests. What lab tests do you need to really assess how you're functioning and how you're doing? So first off, we have conventional lab tests, and some of these can be very helpful, like your standard blood tests, your CBC, your CMP, comprehensive metabolic profile, your vitamin D markers, hormone markers, digestive markers, and there's a lot of things that we can look at, and instead of using the conventional broad spectrum lab range, we can use more narrow or functional lab range to pick up dysfunctions in some of these categories. So let's outline this here and see how it looks. So here's your standard lab reference range. This is your standard lab reference range, and again, 95% of the population have to fit into that range. So essentially 2.5% are on the high side, and you get 2.5% on the low side. So we all know, if anyone that's gone to an airport and seen a whole crowd of people, you're going to know 95% of the population is not healthy. So that's definitely suspect. And again, as the population gets sicker, guess what happens to the lab reference range? It gets wider and wider and wider, and more people are going to slip out of it. So if you're waiting to get picked up by the standard lab reference range, you may be waiting a while, maybe forever. Some people continue to go back. They don't feel good, and their doctor, what they're basically saying is, you're normal, or it's all in your head. Translation, our lab tests aren't sensitive enough to pick up your imbalances, so keep waiting until you finally get picked up, or until the test finally picks you up, until it catches you. And that's not acceptable for lots of people. So we want to look at our lab test, and we want to create a spectrum, a functional reference range, where we can say, okay, this is where health is. This is where optimal health is. And after we start deviating outside of that reference range, let's say right here, maybe things start to become a problem. So we have ways of picking people up before they're an issue, and then we can take this range and we can narrow it down. So this would be our range, and we can look at various markers like albumin, globulin, creatinine, and BUN, and we can assess hydrochloric acid or gut function. We can look at hemoglobin, hematocrit, and red blood cells, along with MCV, MCH, and MCHC to address B vitamin issues, anemia issues, right, whether it's B12 or iron. So we can look at lots of different things in the body and get lots of information from blood tests. And if we use a functional model, we can infer even more information. With certain tests, we're going to have to use a blood test to look at thyroid function. And some hormones, it's helpful to look at blood. Let's talk about some other tests and how we can trace it back to look at body function. So when we're looking at function, it's helpful to look at symptoms, only because symptoms can help trace us back to the body's systems that are out of balance. So we don't have a symptom-based approach. The symptom-based approach is the easy way out. Right? That's what allopathic medicine approach is. It's really cookbook medicine. You have a symptom, right? Let's play the game. You have, let's say you have GERD, right? It's acid reflux. What are we going to do? The medical doctor's going to prescribe omeprazole or Nexium or Prilosec. If you have depression, again, what are we going to prescribe? Well, either Wellbutrin or a selective serotonin reuptake inhibitor, maybe a Zoloft, for instance. Let's say we have some hormonal imbalances. If you're a cycling female, we're going to give you the birth control pill. If you're a menopausal female, we may give you Premarin and Provera. And this game continues to go on and on, right? We're chronic pain. We're going to give you an NSAID, 800 milligrams of ibuprofen. Over here like so. Let's say you're tired. We're going to give you prescription of Thyroid. So it doesn't end. You can see symptom, 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 and we're not getting to the root cause. So symptoms are only helpful if we trace them back to the body's systems that are out of balance. So let's do that right now. Let's trace it all the way back here. And what we're going to do is this. We're going to outline our body systems. This is what optimal health is. This is health. And then from health, we have our hormonal system. And in our hormonal system, we're going to have our adrenals, our thyroid, and our female hormones. ATF or ATM. Adrenals, thyroid, female hormones, adrenals, thyroid, male hormones. And this is our hormones over here. Up here, the next thing we're looking at is our guts, as well as chronic infections. So you come into my office and we see potentially a bullseye rash, like a Lyme's type of presentation, or unknown symptoms. We may want to look at chronic infections like Lyme disease, or we may want to look at gut infections like various parasites or bacteria or SIBO or chronic fungal issues. Again, 70 to 80% of your immune system exists in your gut. So if we're starting to have chronic health issues, we want to look in the gut. We want to look at chronic infections. We want to make sure that you have the ability to digest, absorb, and break down your nutrition as well. And you can see if our stress handling system over here isn't working, we're going to have fatigue. We're not going to be able to manage inflammation and stress properly. That then causes our gut system to break down, because this is where 70 to 80% of our immune system is located in the gut. So chronic infections, poor absorption, poor breaking down of food, we're going to have more issues. And then what happens is a lot of our toxins are excreted via our hepatobiliary system, meaning our gallbladder and our liver. So if our gallbladder isn't pushing out bile properly, if we're not breaking down food, you can imagine that we're going to be reabsorbing a lot of toxins, and our detoxification systems get very stressed. And this could be from various nutritional deficiencies, not being able to make enough glutathione. Glutathione is our body's master antioxidant and is used for detoxification. It's made from protein, from cysteine, glutamine, and glycine. And if we have inadequacies in our digestion or we have chronic infections, we may not be able to detoxify properly. So again, ensuring we have the nutrition that's there and ensuring that we decrease a lot of the stressors that are affecting our liver and gallbladder will help our detoxification system function better. So let's recap. We have standard blood tests that can look at thyroid function and that we can look at more sensitively, like on a CBC, to pick up various anemias, various malnutrition, low stomach acid, chronic inflammation, hormone, low vitamin D, things like that. Now, on the hormone side, we may want to look at lab tests, like I mentioned, on the blood side to look at thyroid hormones. We may want to run a salivary hormone test that looks at the free fractions of the hormones over here. So this would be our salivary hormones. Over here, we may run some blood tests to look at chronic infection, right? We have our Lyme's. We have our various co-infections of Lyme's. This could be Babesia, this could be Bartonella, Ehrlichia, etc. And then we have all of our parasites and bacteria and fungus and viruses. So the more sick someone is, the more we like to go in this area, because we know something is there that's draining the immune system and putting stress on the body. The less sick someone is, the more we don't have to spend as much time here. And then last but not least, we can look at detoxification system by looking at an organics test. Organic acids are essentially metabolic byproducts, and essentially these metabolites form if we're not able to convert these organic acids from A to B. So how organic acids work, imagine you have A has to go to B, and essentially we need certain nutrients, maybe zinc, right? Maybe glycine, to make that metabolite happen. So if we don't have enough of these nutrients, we may start to see a low amount of B and a higher amount of A because we're not converting that pathway properly. So we can look at detoxification pathways. We can look at chronic gut infections. We can look at chronic immune stressors, and we can look at chronic hormone imbalances, thyroid, adrenal, and female hormones or male hormones as well. So again, the goal is we're tracing back the systems to the underlying symptoms that are expressing itself. Not treating the symptoms individually, tracing them back like a map to say, all right, we have gut issues. These gut issues could be causing depression, right? You wouldn't think gut issues causing depression, but go look at last week's video. It's very common. We could say, all right, our adrenals are fatigued. We don't have enough cortisol or our corticosteroids, our natural cortisone. That means we could be extra inflamed and in pain. So maybe it's not an ibuprofen deficiency, maybe it's adrenal fatigue. Or maybe our adrenals are so low that we are starting to have PMS or hormone issues. So maybe it's not a birth control deficiency, maybe it's a stress/adrenal imbalance. So we can trace, again, the systems back to the stressors and vice versa, and then we can get to the root cause and not just treat the symptoms with medications. Again, this is Dr. Justin here. Again, feel free and check below for more information and subscribe to our YouTube channel so you can get more videos coming your way right away. Thanks. Have a great day.